I'm John Evans. Welcome to another episode of One on One. This coronavirus pandemic has brought out the good in a lot of people. Many are reaching out to those who are less fortunate right now, whether it's shopping for the elderly, donating to food banks and food kitchens, trying to help those who are at most risk of contracting the virus. One of the best stories that I've seen so far is the story of a former worker here at WECT, Sanah Sayani. She was a weekend morning anchor here and left us in 2013 for one of our sister stations in Columbia, South Carolina. Sanah left that station in 2015 and got out of the news business entirely. Now she's a business owner living outside of Atlanta, Georgia. One of her two businesses, Thread Beauty Spa, had to close last month because of the coronavirus pandemic. When Sanah learned there was a shortage of protective face masks and that people were at risk for contracting the virus if they didn't have one, she decided to do something about it. She used her beauty spa and turned it into a mask-making operation. It's called Tucker Makes Masks. Sanah Sayani, I can't believe it's been 7 years since you left WECT. You went to our sister station in Columbia, South Carolina, but now you're out of the TV business and a business owner. I guess if you were in TV, you wouldn't be churning out the masks you're churning out right now, would you?
No, I'd be reporting the news, trying to keep people safe that way instead of this way. One way or another, we would have been keeping people safe.
And this is a great thing. How did Tucker Makes Masks, how did it evolve? I know you own a salon right now, and the idea came out of trying to help, but give folks listening the long version. We got plenty of time.
So the way this started was, it was just a freak accident, I would say. Just you scroll through your news, your Facebook feed, and as I was scrolling, I saw a tutorial to make a mask. It was around that same time, I believe it was the day before, or that same day when we were all being told that the CDC had said that healthcare workers could use bandanas or scarves. And I remember all my healthcare worker friends just kind of going crazy and erupting and saying, hey, this is wrong. We can't do this. We need proper PPE. And I'm just thinking, okay, so you guys need the PPE. If masks is a shortage, people should act like they're sick, because I had just heard 4 out of 5 are transmitting the virus being asymptomatic. So I said, okay, so if we're supposed to be sick, the sick is supposed to be wearing masks. There aren't enough masks out there. How are we supposed to protect each other, or at least ourselves, from infecting others if there are no masks? So tutorial, saw the article, said, hey, maybe we can make our own. I messaged my doctor friend in Dallas, and she said, yes, we should all be wearing masks. Yes, the CDC is probably not saying or recommending for everyone to wear a mask because there's a shortage. And I feel that things have just been a little slow to react in general. And I said, it can't hurt to make masks and it can't hurt to wear masks. So I just kind of had the idea, confirmed it with a couple of doctor friends. They said, yes, go for it. And I just started. It just started not knowing where this would go. I did foresee that the CDC would eventually say wear a mask because other countries were already wearing it. And it does no harm, so why not? And that just kind of started Tucker Makes Masks.
But the amazing thing to me is of this whole thing, Sanah, is that you have churned out, I guess you're probably over, 7,000 now?
Yeah, we're almost at 8,000 now.
Wow.
I'm pretty sure by this weekend we will hit 10,000. And it's been amazing because it's not just me making the masks. And of course, I have found a way to streamline it to make faster production ourselves. But we have countless number of volunteers in the community that are either making masks or giving us fabric or doing just a couple of parts of the mask making process, and they don't have a machine, or they're cutting fabric, or they're making ties. Just the community has just come together in whatever way they can possibly help us to meet the goals. So where I'm telling people it takes us 7 to 10 days to complete a request, right now I'm filling orders from April 17th, and it's April 22nd today. So yeah. I'm at a 5 mark, and we're just going as fast as we can, as quick as we can. Basically, that's all we can do, and the community is supporting us and helping us do all this.
Yeah. Now this is not what a salon is designed for. As I look at you as we do this Skype interview, I see dressing rooms, I see a lot of things back there. So your first couple of masks, what did you make it out of? And then did you reach out to people? I need fabric, I need elastic. How did that all come about?
So with that tutorial article that I saw and being in the news, research is kind of our forte.
Yeah.
I started researching and just in the research found, okay, this is the type of fabric we need. This is where we need the basic tools that we will need. Yeah. Mom had a sewing machine. She has basic sewing skills. I have zero sewing skills. And she just said, all right, I'll help you in this. We went to a local store here called Fine Fabrics that has fabric. We went and picked up fabric. It was the wrong fabric, but we learned. And that is kind of how it started. We picked up the fabric. Somebody said, this is not the right kind. This is the right kind you need. We went back out there, and then just kept going and going. And what happened then was I was picking up bulk fabric, as I am still picking up bulk fabric. People now, they were coming to me to get the fabric, making masks and giving it out, instead of everybody going to the fabric stores and just kind of flooding them. I had started that initially, where people were coming to me getting fabric, making masks, elastic, whatever supplies were at that time, based on my demand.
Now, how many employees did you have at the salon before you closed?
So we have one employee and me. It's a brand new salon. We celebrated our 1-year anniversary on March 7th and had to shut down March 21st. So
wow.
It's just one, and she's right now sitting at home, not doing anything because I'm only got my mom and I in here, and my brother comes and helps us out. So, we try to keep it just family, and basically instead of being quarantined at home, we're quarantined in here. And we're just keeping it that way. Just one staff member is what I had.
So how many are actually in there? I see your mom behind you and you're sewing, but hi, Mom. She was waving over your shoulder there. How many people are actually helping you sew? You said that you've reached out and people are bringing things to you, so you have people in other areas doing the same thing, correct?
So they're doing it in their homes because we can't congregate, right? It'd be wonderful to have 10 people in here, 10 machines going. You could probably churn out 2,000 masks a day, but we can't do that. So it has to be done at people's homes. I would say, I haven't actually counted, I do have a list running, maybe 15 to 20 mask makers out there doing this in their homes or helping us in some sort of capacity that is contributing to the direct mask product at the end. So yeah, it's a big effort. It's just happening individually in people's homes, and we try to make it as easy as possible for them to get these masks out as fast as possible.
Where was the first order? Where did the first order come in from? And when did you realize, we've struck on something here?
Honestly, I have my data sheet. The first order, I think it was just like friends and family, when I put it out on social media, I created a group and I put it out on social media. I had the VA, she's an existing client of ours. And I remember hers being the first one that I filled and was ready to go. She ordered 25 masks for the VA hospital. And then I sent the second one was to my doctor friend in Temple, Texas, who told me, do this. So she's like, I need some masks. So I sent it to her. But that's kind of how it started. And then as the word started to spread, we started to get more orders. And then the local news picked it up here. And that just catapulted the request. We had 1,000 requests in one day. And we've caught up on everything. And now, of course, the news impact has simmered down a bit. And the supply in the market has increased because a lot of people are making masks and selling them, those that are out of jobs. This is not a cheap ordeal to do. It takes time to do this. It takes a lot of energy to do this. So people are making masks and selling them. There are KN95s on the market. There are other types of surgical masks on the market. So the demand has died down a little bit. But I think that is just because I'm not out there in people's faces every day. As soon as I post something, it kind of kicks back up. Because there are people who still need masks and they still aren't able to find them, whether it's monetary, because a disposable mask is about $3 per mask that you throw away you should be throwing it away after one wear, but people are wearing it for a week and then throwing it away. Whereas the cloth mask, you just wash it and keep it going. That's it.
Now, you have a Gofundme page that is helping you, I guess, offset some of the cost. Knowing you as I do, I know you didn't get in this to make money. You got in this to help people, but there is a GoFundMe page for Tucker Makes Masks. But do you have any idea, I think you raised about $6,100 in there. Do you have any idea how much you've actually spent out of your own pocket in this endeavor so far?
So here's the wonderful part. I thought I was going to have to spend a lot out of pocket. I didn't have to do anything starting the first day. I think I probably spent $100 the first day out of pocket and immediately got that $100 back in donations. I would say, because it's not just on GoFundMe. People are donating in other facets also, cash when they pick up, Venmo, Cash App. I do have other options, PayPal. I would say I have probably raised up until now 6,100 on GoFundMe, about the same on in the other forms of methods of donating. So about
Wow.
1,300, 13,000. Yeah, we have definitely raised that much. And on the flip end, I have probably spent about four or five of that in fabric costs and in just materials. So we had to stock up. We had to get cutters and boards and just basic supplies that people need to mass produce this.
Uh, are there any requests for different kinds of fabrics, or are people just happy to get what they get?
Well, they're happy to get what they get. Now, when I do go shopping, rarely when I do go to Joann to pick up an order and I decide to go inside, I do see people picking up other types of fabric, and then I stop for a second and I'll tell them, you remember you have to wash this every day. So a sequin fabric or a polyester fabric or anything that cannot withstand washing daily basis is not going to work for you. The second thing is you need to be able to breathe through it, and you can't breathe too much through it. So there's the lighter test where you take a lighter and you blow through it. And if you blow out the lighter, that means your fabric is too thin. And if you can't blow it through and you can still breathe through it, you're good. So it is a fine line as to what types of fabric work in this scenario. But the bottom line is you should be able to breathe through it, and you shouldn't be able to blow out the lighter, essentially.
Where's the strangest place that a request came in from?
I sent it to London, UK. So there,
Wow.
I sent it to my aunt there. I have sent it, right. I just filled out Oklahoma today, Pennsylvania, Michigan, Jersey. Those were all today's orders that I mailed out this morning. We have sent to Nevada, California, Florida, Texas, everywhere. Anyone who wants one can get one. New York, my goal is now 50 states. Let's try to get all 50 states out on there, because that would be amazing. But I know the need is there, and I know the demand is there. I think as more people find out about it, they are requesting.
What are your plans moving forward? Is this something, because we really don't know when the end of this is going to happen. So I imagine you're going to just continue this process as long as you need to?
Yeah, so that's been a hot topic of debate lately, because with, Georgia trying to reopen spas, salons, my industry, the debate has been, well, because Georgia is reopening, then the unemployment, rent relief, all of that doesn't follow. I still have to pay rent here to keep my lights on here. I still have to, I'm using the facility at my spa, so I still need the facility. We have been debating as to how we want to do this. If we want to switch it to where we kind of sell something through Thread Beauty Spa, and we employ people. We're debating how to do this. But bottom line is, if you want a mask, no matter when you want a mask, how you want it, we will get it to you. And I will stop when there's no longer a need for masks. And if it turns into a want, then the want can be taken care of in different ways, whether it's you buy a mask for however money, whatever it is. If we end up selling masks to be able to keep the lights on in here, it will still be for like $2 or $3. It won't be $15, $20 a mask. And the purpose will literally to be so that I can keep my lights on and I can continue this project in this environment. As far as reopening my spa goes, I don't plan on doing that anytime soon until it's safe. But I have to think of it as a business owner financially. How am I going to continue doing this? So I am evaluating things, but the bottom line is, if you need a mask and you can't afford it and you're going to get it for free no matter where you are. I will ship it to you, and it will be at zero cost.
Well, tell us a little bit about your salon. What kind of services, when you do get back into business again, I want folks to know about Sanah's Salon. Tell us a little bit about it, what kind of services you provide, and where you're located.
So I'm in Tucker, Georgia, and we do threading, waxing, facials, hair. We do everything, lashes. We do everything but nails. Anything that is required, all beauty stuff. We take care of everything but nails. And right now it's just a little hot of a time to do those things, and a lot of debates out there. So yep, that's what we do. We're looking forward to resuming doing that. And if and when we go back and the Tucker Makes Masks project still is a need, that will still continue on simultaneously.
And what's the name of the salon?
Thread Beauty Spa.
Thread Beauty Spa. Why did you get out of news? You were good.
So I actually love being behind the camera. As a producer, I loved it. I miss it. I miss it every day. I still miss it. The reason I got out, and the real honest reason is, as people who are already in news know this, behind the scenes is not financially lucrative as much as you would want to be, as much as you would need to have to survive. And with that industry is, you are always moving. You're going to a new station. And when you go to a higher station in a better city, you start at the bottom of the ladder again. Nights, weekends, overnights, all of that. My family's in Atlanta. I was tired of working overnights and weekends. I was finally on a dayside schedule, which is, 8 to 7 in our industry, dayside.
Yeah.
8 to 7. And I just was away from family, and I just missed family. I wanted to be back home. I was coming home every other weekend from Columbia at a 2.5-hour drive, and I just got homesick. And financially, it wasn't the best for me. Now, I have gotten such great contacts, and like yourself and everybody else that still remembers me and reaches out to me, that if I ever wanted to go back, I could. I could go back. And that was just one of those things that at that time I weighed the pros and cons for my future, my needs and my wants, and made the decision to step out of the industry. But trust me, doing this through Facebook, I still feel like I'm a part of that industry, and I'm still reaching out to people. I'm still informing people of the know-hows that they need, like I would be doing as a producer.
You owned a pizza franchise as well, so you're becoming an entrepreneur and the major business owner here.
I still have Marco's Pizza.
Yeah, you should, and that's not far from where you are right now, right? The Marco's Pizza in Decatur, right?
Yeah, in Decatur, which is just 15 minutes from here, yeah.
And business-wise, I imagine this is a terribly difficult time.
Yes, it's a struggle where I have one business who took a first hit in the first couple of weeks. Marco's dropped in sales in the first couple of weeks, but then as things started to kind of level out, they got through their 2 weeks worth of groceries and started to go back out there to start doing carry out and delivery. That has started to do well now. Like it's back to normal, I would say. I was the first one to shut down dine-in at my Marco's. I did it the same time I started this business, this effort here. I shut this business down. I shut down the dining there. I'm doing whatever it takes to keep my staff safe, and keeping my staff safe means I can continue serving the community food there. It's been tough with two different businesses, one that's actively running, that needs love and attention, that needs the safety, one that is shut down. I have to worry about rent, bills, and everything here, labor here. So two different businesses with two different outcomes right now.
Yeah, and one of the things that I've noticed, and I'm going to ask you because you have experience in what I'm still doing for a living, but you also have experience in being a small business owner, and you're also helping people with Tucker Makes Masks. What are you noticing in the public right now? Are people afraid? Are people anxious? Are people angry? Are people confused? Give me your sense as somebody who's been in the media, who's technologically savvy, and who's active on social media, and also a small business owner. What are you seeing now?
All of the above, everything you said. People are confused as to what emotion they're feeling right now, because at one end it's that I have bills to pay. I'm out of a job. I do the type of job that I do as an independent contractor. I can't get unemployment. Maybe I can get unemployment. Maybe there's PPP. Maybe there's SBA. There's so much maybes out there that people are just like, what is happening? What's the truth? What is the bottom line? What do I need to do? So my decision of not reopening this Friday has been welcomed by the community. Now, there are people who are saying, well, do what you need to do. Don't tell people what to do. If you don't want to open, don't go out. If you want to stay at home, stay at home. We get that. All of us get that. My only concern is by this industry reopening. I have no problem with other industries reopening with the 6 feet social distance. You go through the guidelines, do what you need to do, best to what your gut is telling you to do. This industry, just for me, makes it feel like
you just cut the fabric, yeah?
They were about to give us unemployment because it did say, when I did file for it, it did say independent contractors they were going to reevaluate everything. Now that they have said reopen, all that's done. So even though I choose not to reopen, I don't qualify for unemployment anymore because I can reopen.
Right.
Same with everybody else, all the other industries, the nail techs, everybody that I speak with, they say, look, we don't want to go back to work. We're afraid. But we have to go back to work because our bosses are opening, because they still have to pay rent because they're not getting any relief. So it's a domino effect of we have to do this because we have to feed ourselves. We don't want to do this because we understand it's not safe, but we have to feed ourselves. And how do we do this? So it's a double-edged sword. We're in a catch-22, and everybody is feeling everything right now.
When you go home at night, I know you work, I guess, about noon to 8 putting the masks together. When you go home at night and you think about the impact that this Tucker Makes Masks project has had, what do you think about? Is it pride? Is it, I can't wait to get up again tomorrow? Is it, I'm so glad I could help somebody? Because to me, it would be, you know, I'm helping my community in a small way. But I want to hear from you what you think about when you lay your head down on the pillow every night and you think about Tucker Makes Masks.
I am thrilled to be doing this. I look forward every day to do this because this is my new baby in a sense. It's my new project because I started this with the idea of getting a mask in everyone's hand. And now I'm able to ship it to people. I'm able to send it across the nation. I didn't think it was going to get past this community, but it did. I look forward to it every day because of the sheer volume of the amount of people that are being impacted by this. If you need something and I can get you that, I'm going to get you that. That's the spirit of this community. And every day, I just took a picture and posted on the group Tucker Makes Masks, a thank you card. I get thank you cards every day. I at least get one in the mail. And I just got somebody just send an edible arrangement to us because of this. They're like, it was I don't even know what, it's an ENT, some care. They sent it and I'm like, this is amazing. So just those things, like those little moments, there are times that I'm like, oh, I'm tired. I'm doing this. I do 8 hours, 9 hours here. I go home and then I make packages to mail out the next morning. So I'm working till 12, 1 o'clock at night. But every day I'm like, I got to do this. I look forward to doing this because I feel like some way or another I'm still able to help people. And right now we need people helping people. When we disagree with how our leaders are helping us, people can step up and take that charge and do the best they can do.
Have you surprised even yourself sometimes?
Every day, every day. I calculate the amount of masks that we send out every night and I'm like, oh my gosh, we just did this many? Like it's crazy. It's mind blowing. I never thought it would get this big, but I am so happy it did. It's been 1 month now. 27th was the first day we sent out our first package. But you know, it's amazing. It's amazing. And I look forward to it every day to do this. Can I be a little secret? I want to do this for as long as I can do this so I don't have to get back to threading people's eyebrows because I love doing this.
Well, it is a true labor of love. I can tell just by the way you talk about it that you really do care. And that's why you're doing this. Again, you're not selling these things. These are going out free of charge. All somebody has to do is ask. That's the amazing thing to me. I mean, this is a country built on, entrepreneur and built on, ingenuity. But what you're doing is built on kindness.
And there's people here that are doing that. People are making signs. They're doing little group things, decals, whatever. Not everybody can afford to do it for free. Not everybody has the budget to do it themselves. So they do need a little bit, like $5, $10, whatever, to kind of keep the community spirit going. But it's not profit. It's literally removing the cost it takes to do it. That's it. And the donations, like I mentioned, they've been overwhelming and people are appreciative. And it's amazing. So, yeah, the spirit is great in this community and are all around, I'm noticing.
Well, I still remember the first day that you went with me and a photographer to interview the late Congressman Walter B. Jones, your first day here in Wilmington. Hard to believe that was 8 years ago.
Oh, I know. I look back and I'm like, 2015. Wow, we're already in 2020. I left in 2015. Milestones. But I'm so happy that we've all been able to stay in touch, and social media has given us that ability to continue to keep tabs on each other. Because I have been keeping tabs on you too. We just don't say anything. We see it, and we're like, we're doing well. Good. We move on. But it's been incredible.
Before we go, I do have to ask you one thing. Pull down that mask and let everybody see that great Sanah smile. There it is.
There it is.
It's so good to talk to you again, and we really truly are so happy for you and really proud that you've been able to turn this labor of love into something that's helped so many people.
Thank you, John.
A big thank you to Sanah Sayani for taking time from her day to join us for this week's podcast. If you'd like to join the mask making effort, there are a couple of ways you can get a hold of Sanah. You can visit her on Facebook and on Instagram. She's very active on social media. The Tucker Makes Masks effort has a Facebook group of its own. The Gofundme page is still up and running, and her business, threadbeautyspa.com, that's a way to reach out to her there. Now, before we go, I'd like to ask you a favor. Please download and subscribe to the One-on-One with John Evans podcast on whatever app you use to listen to your favorite shows. And if you would be so kind, please leave us a rating or a review. The more ratings and reviews we have from listeners like you, the higher we'll be listed on the apps, and the better chance we'll have of bringing in even more new listeners. I'm John Evans. Thanks so much for joining us for this week's episode of One-on-One. Stay safe.